that better? Okay, we're gonna give you a little warm up. We work out 3 times a week around DC, Mondays at Meridian Hill, Malcolm X Park, Wednesdays over at the Lincoln Memorial, and Fridays we work out all throughout the city. But every single November Project workout starts with a little bit of a bounce. Emma, you wanna get us going?
Yeah, so we're just gonna bounce right where you are. Yeah, so we're just gonna get those bodies a little warm. So at November Project, we like to give a lot of high fives, a lot of hugs, but you know, we're keeping everyone's health in mind right now. So I want you to turn to the person next to them, give them a little elbow five or a foot tap. Tell them you're glad they're here this morning. That's great. All right.
Now, I know a lot of people like to run with music, listen to music, and who better to get us hyped this morning than my girl Lizzo? So y'all are just gonna repeat after me. I do my hair toss. Check my nails. Baby, how you feeling? Good as hell. I do my hair toss. Check my nails. DC, how you feeling? DC, how you feeling? DC, how you feeling?
All right, the thing we do to wrap up the bounce, keep bouncing, keep bouncing, keep bouncing. I'm gonna say good morning, you're gonna say good morning back, I'm gonna ask how you're doing, and you're gonna say, oh yeah, you got that? All right, let's get it up, 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 up. Good morning. Good morning. Y'all good? Y'all good? Turn to 2 more people, give my elbow bump or a fist or a foot tap. Tell them you're glad they're here this morning.
Thanks for having us. We hope you're warmed up. We hope we'll see you at a November Project workout soon. Folks, give it up for your friend and mine. Mayor Bowser's here.
Morning, everybody. Welcome to Herstory 5K and happy Women's History Month. But ladies, let's tell everybody every month is Women's History Month. I am just really delighted to welcome you on behalf of all of us in DC government, the Department of Parks and Recreation, for the 2nd annual Fit DC 5K. So let's give a big hand to our sponsors, Pacers Running and Vita Fitness. Thank you for the bibs and timing service, Amer Group and BSN Sports for the t-shirts. The Nationals Women's History Museum for providing incredible women's history facts along our 5K route. And lastly, to the best in the business, your DC Parks and Recreation. So once again, we are just going to continue to be together as a city, to enjoy our beautiful city, to be proud of all that we have accomplished together, but also know that there is more work for us to do. I couldn't be more proud than to be your mayor and to get to work on the tough things that will make us an even better city. Like making sure that there is equality for women and girls. Making sure that no woman has to fear being bullied in her home or at work or discriminated against. And making sure that every girl and woman aspires to be whatever she wants to be. Doctor, lawyer, forensic scientist, mayor, or president of the United States. So let's keep pushing our girls, and we know that a strong mind, body, and spirit helps us get along the way. So rock, run, jog, push, stroll, but have fun today. Thank you, DC.
One more time for Mayor Muriel Bowser. Are y'all ready for this 5K? Then stop being slow. Get to the start line. You will see times lined up. Line up according to the time you believe it'll take you to do this race. In the event that you get cold, we have 2 very warm DPR buses at the end of your trek in case you need to warm your toes. If you really love your girlfriend, you'll do an ankle check. I just found out mine were ashy. I'm gonna handle that before I get to the line.
All right, good morning, everybody. Chilly morning, but we'll get started. My name is Gregory McCarthy, and I have the privilege of serving as the president of the Board of Trustees of the DC Public Library. And I'm joined here by 2 of my colleagues. Leif Dormjo is here today. Where's Leif? There he is, back there. And Monty Manash, 2 excellent public servants. Thank you very much. So I have 2 jobs today. One is to welcome you, and the other is to acknowledge the VIPs in attendance.
And now, we bring you the following live press announcement from DC Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and I'm here to provide the district's briefing on our response to COVID-19, and then you will have time for a few questions. Last night, we reported 94 confirmed cases in Washington, D.C., bringing our total positive to 495. Each day, you've heard a consistent message from me and everyone in district government, and that message is to stay home. Yesterday, our entire region took an additional step to reinforce this message. D.C., Maryland, and Virginia all issued stay-home orders. The district's order goes into effect at midnight. And to be clear, there's no real difference between the directions we have already given residents to stay home. Still, I want to reinforce the only reasons you should be leaving your home are the following: obtain medical care, food, and essential household goods, perform an essential government function, work at an essential job, engage in essential travel, or to exercise according to guidelines. Many people want to know how they can help right now, and for most of us, the biggest way to help is to stay at home. Later this week, we will share more information and details about new surge projections and when we expect to experience that surge here in DC and the capital region. Today, I can tell you we are pushing out a large supply of personal protective equipment to local healthcare providers. In just a moment, Assistant City Administrator Jay Melder will talk more about what we are delivering in our overall procurement process. Of course, all of this, projections and procurement, relies on having good data. And as you know, we have been sharing as much data as we can each day, and we plan to continue to do so. However, I want to tell you about a change we will be making. If you have been tracking data, you know that we have been releasing it about 7 p.m. each night. But going forward, we will be sharing data in the morning so that we can provide a more complete picture of the previous day. The data that comes out in the morning will be sorted by age groups, sex, and ward. Again, I want to finish by saying the best thing that we can all do to protect our healthcare workers and our city and to flatten the curve and to get back to life as we know it in DC is to stay at home. Be strategic about your trips to get essential items. Do your part to keep everyone safe. So with that, I want to turn to Jay Melder for an update on our procurements.
Thank you, Mayor. Good morning. Wanted to talk to you today about the 3 supplies we're building in the District of Columbia to support our local healthcare providers, to support our first responders, and to support our essential government employees who are showing up every day to do essential duties. You'll see some examples of materials today that we will be sending out from our local strategic supply of PPE and medical equipment to our local health providers. Those are hospitals, primary care providers, long-term care facilities, and home health aides, among others. This is being delivered, more than 70% of our current stock will be delivered over today and tomorrow to those providers. We continue to source mostly from DC local procurement, our 3 supplies. We continue to seek assistance from the federal government, both from FEMA and from the Department of Health and Human Services and their national strategic stockpile. As we move forward and continue to rely on data to understand our need and to understand what our burn rate for the PPE and our health equipment will be, we will continue to do everything we can to make sure that our health providers and our first responders and our essential employees are well equipped for the mission.
I want to provide a readout of the frontline employees and first responders who have impacted by COVID-19. And as the mayor stated, we're going to provide an update this evening of those who went through the high volume testing site yesterday. For fire EMS, there are 14 individuals who've tested positive for COVID-19, and there's 172 individuals who are out for quarantine. For MPD, there are 6 individuals who've tested positive for COVID-19, and there are 176 MPD personnel who are out as a result of quarantine or positive tests. For the Department of Corrections staffing, there's 1 individual who's tested positive, and there's 103 individuals who are out right now for either quarantine or isolation. And then for DOC, those within their custody, they have 6 individuals who've tested positive, and there are 88 individuals who are in isolation or quarantine. And for our Department of Youth Rehabilitation Services, they have no staff who've tested positive, but 40 that are under quarantine. And DYRS has 1 youth within his custody who's tested positive, and then 8 that are either in quarantine or isolation. And this will be updated tonight based on the high volume test done yesterday. Thank you.
And let me make clear a point that Kevin just emphasized. And when I mentioned that we will be changing our reporting times, we will begin that tomorrow. We will have a report tonight, and that report will only be on first responder information. And then we will go to the entire sampling group tomorrow morning. Any questions? Yes, Mark.
Officers and whoever else would be enforcing the stay-at-home now that they have at their disposal fines and jail penalties?
We don't expect that we will have to issue any fines and jail penalties because we expect the people of the District of Columbia to comply. We do, of course, have penalties at our disposal, but I don't expect that we will have to use them. That's certainly my hope. We have, and I just got a recording from our MPD officers who have a script that they are using on their loudspeakers. They were just out at Lincoln Park this morning with that script, and it's urging people and reminding them of that they need to stay at home, but if they're going to be out, to practice social distancing.
So, Mayor, it would be a situation like they'd go someplace, they'd see a crowd, and that's essentially what it means?
What means?
Violating the distancing law. The point of this whole thing is...
The point of the whole thing is for people to stay at home. And so they will be reminded to stay at home. And if they're outside exercising, they will be reminded of social distancing requirements.
You talked about basketball games one day last week. Would that be something that would cause the police to come and say, you got to move on?
Yes, it would. It violates the rules about exercising in groups.
In an individual case, you could just say you were on your way to the store, or you were, I'm trying to think
An individual case is not playing pickup basketball.
Right, I understand it, but I'm trying to find out a situation in which you could actually be arrested.
As I said again, Sam, the point is not to arrest anybody. The point is for people to stay at home. And we are going to make all of the guidelines available and rely on people to do what is right for themselves, their family, for nurses, doctors, first responders in our city.
I have a question about the DC jail.
Yes.
The Public Defender's Office and the ACLU filed a lawsuit against the city yesterday over conditions in the jail. And having looked at it, a lot of it is about having cleaning materials. Are you satisfied with the current situation there?
I haven't really had a chance to review the suit, but we will address the suit. And we have posted at all of our government buildings, and we'll make sure that that's happened at the jail too, all of the cleaning schedules. So anybody that has to go into those buildings understands the regular cleaning that's happening at those buildings.
I'm talking about the people that are incarcerated. According to the lawsuit, they're given a bar of soap when they get in there, and many times that's all they get, even when that's used up.
As I said, I can't really comment on the lawsuit right now, Sam. We will review it and refer it to our legal teams. Yes?
Mayor Bowser, in other states, we're hearing about police officers pulling over people from out of state and asking them why they're there. Do you foresee that happening here in the city, where DC police officers will pull over people, say, from New York and ask them why they're in the city?
We don't expect that to happen. We certainly know that our borders are fluid, especially in the National Capital Region. There are people who live in Maryland that do essential work in D.C. and vice versa. So people are crossing our borders. We want to call everybody's attention, however, to all the essential things: food, medicine, going to an essential job or essential travel that you have to do. We have notified everybody in D.C. government, wherever they are in the region. I have employees that live all around this region to make sure that they have with them an ID that shows that they work for D.C. government, and they can demonstrate that they're on their way to essential work.
And if I can follow up, has anyone or any non-essential business in the city continued to operate that you're aware of that has been fined?
Not that I'm aware of. We do have the ability to fine. We also have the ability to revoke a business license for any business that is knowingly violating the order. Yes.
Mayor Bowser, you mentioned how you're not planning on just giving out fines willy-nilly to enforce the stay-at-home order, but is the city government doing anything different on going about enforcing it? Are police changing patrols, or other people in D.C. government hitting the streets to make sure people are staying at home or practicing social distancing?
As you know, Finney, we started that process last week. We started it longer than that to enforce social distancing around the tidal basin, where we're using the Metropolitan Police Department and the National Guard. We also we changed the contract that we have with our school safety officers so that they could be deployed to parks and playgrounds and recreation spots where we saw people distancing. We've used police tape, in some cases to indicate that the park or playground is closed. The police since last week have been encouraging people not to play pickup games all across the city. So all of those things continue to happen.
Does the city have any evidence that undocumented people aren't seeking care, or that might be an issue going forward with coronavirus?
We always want to make it clear to people that immigration status doesn't matter when calling on the government for resources, especially medical resources.
Have you had any evidence that people aren't seeking that medical care?
We don't want to have that evidence, Bennett. So that's the point. We yesterday gave part of our briefing yesterday was in Spanish to make clear to people to recognize what their symptoms are and call their medical providers.
You also mentioned yesterday that you're expecting a peak in medical surge in early May. Does that mean that residents should expect all these restrictions to continue into May?
Actually, what I said is that we would be providing a briefing on our expected surge later in the week. All of my orders are in place through April the 24th, which coincides with the approved emergency that I'm operating under. It is likely that we'll seek an extension of the public health emergency in the coming weeks.
Can we get racial data on the coronavirus cases? We're seeing other jurisdictions start to release or push for that.
I told you what we are releasing. Age groups, gender, and ward. Yes. Yes.
The Public Defender Service has submitted a motion to release all sentenced misdemeanants in the DC jail. Do you think any or most or some misdemeanant serving sentences should be released?
I'm really not sure about that, what they filed, and I would have to review it to make further comment.
General policy, do you think misdemeanant serving sentences should be released from the jail?
I can't say that categorically. No, I can't say that. Yes.
Do you anticipate to include hospitalizations or in that data?
We have, can I confirm with you what we have with related to hospitalizations?
Sure. And then for the number of people who have recovered, the 121, are those folks still being advised to self-quarantine? What is the protocol there?
I'll have to have Dr. Nesbitt confirm that with you as well. Yeah. Let me get to someone who has to ask the question. Yes.
Mayor Bowser, you mentioned the high volume testing. When did that start? Was it really yesterday that it started properly? And are you expecting a surge in positive identifications given the increase in testing?
I don't know. Yesterday was the first day we had it for our first responders at fire, at DOC, for DOC, and for MPD. So there were, I think, almost 80 people tested, and I think that we will have their test results today.
About the daily average of the high volume for the first responders, about 80 a day?
I don't know, because I don't know how many will be referred. They're being referred by their providers. Yes.
So Governor Hogan mentioned yesterday his stay-at-home order. I mean, he didn't issue any sort of travel ban, but he encouraged Marylanders not to leave the state. Also, if they're coming in from other states to self-quarantine. Is that the same in D.C., or how about a D.C. resident who has to, like, for an emergency reason, go visit a parent across state line and they have to come back? Would they self-quarantine? Should they? What's the guidance there?
I think that anybody who is visiting a high-incident area, which is a lot of areas in the United States right now, should follow that self-quarantining guidelines. Absolutely. Yes.
Can you give us a view into your thinking about issuing the order? What was the tipping point?
I'm sorry?
What was the tipping point for issuing the order to stay home? Can you give us a view into your
As I mentioned, over several weeks, we've already closed down the city for many weeks, and we've always wanted to be in lockstep with the region, so the regional message is the same. Yes. Yes.
Mayor, in Maryland, Maryland National Capital Park and Planning has actually taken down basketball hoops to prevent games from going on. Has Parks and Recreation here done the same?
I think we've had some instances of that, yes.
Is it simply where they're gathering, or are you hearing from different places where they're gathering and then you're choosing places to take the hoops down?
I don't know if they've taken all the hoops down. I expect a yes, or especially in areas where you can't shut down the park, or you can't lock it, or you can't cut it off. So that's another way to prevent the pickup games. Yes.
If there have been any positive cases in homeless shelters, I'm seeing a report out of Harriet Tubman.
Yes.
So is it just the one?
I will let me have confirmation about the locations, but let me just say more generally, if we have a resident of a homeless shelter test positive, that resident is quarantined. Any close contacts follow the Department of Health guidelines. There's a cleaning protocol also put in place.
Some of the supplies, does the district have, or are you getting the sterilization kits for the N95 masks? And then also, what about the expedited testing kits that show the results much faster? Do you have, or is the district getting those?
I think we have one on order, and we'll catch up today on, I know the announcement about the sanitizing machine was made yesterday, and we'll follow up with our FEMA contacts today. Yes.
It could be for you, it could be for the deputy mayor. What was the script that you said that police officers are using in their loudspeakers, and is it going to be across the city for every officer, or is it just select places that they're doing this?
I will be confirming that with the chief today, and my expectation is that there's a general script that's used. Let's see if I can play it, and they'll tweak it as well. Give me a minute.
Can you tell us if you're receiving calls, social media, or anything about people being confused about the stay-at-home order, the differences between the three states, or just the difference between what it was like a couple days ago and the difference on starting tomorrow?
I think on social, some of the biggest questions I've seen are what exercise is allowable. That's been one. We've been pinged by some of our employees, like can they come to work? Can they travel? What does it mean for them, especially folks that don't live in DC? So that those are some of the ones that we've heard. And then I've gotten people say, why do you want to throw people in jail? I answered Sam at length.
Can I ask about the DYRS numbers? Is that Hope Village?
No. DYRS is New Beginnings in YSC.
And so you had been asked about Hope a few days ago and said you were going to send inspectors over there.
We did.
Yeah, can you tell us?
Kevin.
Thank you very much.
Hope Village is a halfway house run as a contract overseen by the Federal Bureau of Prisons that houses about 200 adult individuals, DC residents, who are transitioning from incarceration back into the community. There were allegations made last week, notably about a lack of basic supplies around soap, sanitizer, and the condition of the facility. The city has an independent office called the Corrections Information Council, or called CIC, that has the jurisdiction and authority to do unprompted inspections of those facilities. They did that and found that there were adequate supplies, in some cases perhaps even more than adequate supplies, around toiletries, around cleaning supplies, and they were able to do that site inspection to have their inspectors view it, photograph it, and be able to report out on it as an independent assessment of conditions there.
Okay, a few more. Yes, Martin.
I know part of this involves Park Service because of the federal lands, but there's been calls from some people to close down more roads or kind of expand sidewalks into roadways to give people space to ride bikes and walk because it's a form of acceptable recreational activity. Any thought to that? Have you asked MPS to consider closing Beach Drive on a more permanent basis during the emergency?
I have not. We will continue to. We have established a regular call with them, and we will continue to evaluate their properties. Yes.
What's the latest at St. Elizabeth's?
In terms of what?
Do you know how many people have tested positive? If there's anyone under quarantine?
Okay. Can I get back to you with those, with that number? Yes, sir.
I've heard people who've applied for unemployment benefits try and adhere to the advice to answer honestly when asked about the searching for work requirement, but they also get told from claims approvers to say, yes, they're looking for work, and they get emails from the government saying the same thing, so there's like conflicting advice. I'm wondering if you could clarify what people are supposed to answer.
Yes, I asked the DOES director to issue clarification, so I want to just turn to her advice, Director Morris Hughes, and we can provide you with all of the statements that she has made to be perfectly clear. And let me say a little bit more about that, because I think that you recognize that we made some changes to actually help people get benefits sooner. But those changes required a change to how our system works. And the computer system, we've been working to get those changes made in the system. We're hopeful that that will happen sooner rather than later. We think maybe by the end of the week, but by the beginning of the week, to have those questions related to searching for work and wait period changed in the system. And we think that will prevent any confusing messages generated automatically by the system.
Obviously, first responders and whatnot are the priority for this, but are you making any plans to try to find necessary supplies just for residents who are unable to find hand sanitizer or disinfectant or even toilet paper?
We always are focused on the kind of supply of food and goods. You heard us talk at the beginning of our response about making sure that grocery stores were essential businesses. Those businesses providing essential household items are also essential businesses. And we're relying on that chain. And we're grateful for all of those workers who are showing up, who are loading trucks, stocking shelves, manning and womaning cash registers, who are showing up to work to make sure that that vital supply is available. What the district is doing is obviously procuring for our needs, for our medical needs, and for our first responders and frontline workers. We're also, as Jay mentioned, creating a stockpile that we can support our medical providers. And we're searching the entire globe to find those items. But we are asking our residents to use judiciously, not hoard, not go out every single day to take care of their household items at all the commercial markets and stores. Yes?
What's the guidance on homemade masks? I know just civilians going around for essential business, and people want to be wearing masks, or they can't purchase it or they shouldn't be purchasing it.
Right.
So I wonder what the guidance is around.
Let us check what the CDC is saying about homemade items, and we'll post it on our website. Yes.
What's the situation with the SNAP program, food stamps? A lot of state governments have been appealing to USDA for blanket waivers, for greater autonomy, to expand the roles, to cut down paperwork, to deal with the increased need for food assistance, for food stamp assistance. What's the
I don't
situation
think
with
that
here?
we have anything different to report on SNAP. One of the question has become, early on, we extended any recertification deadlines for people who are getting public benefits. And one question that I'll make sure that we confirm is that people who are newly applying, what all the procedures are for them as well. But please go to our website, coronavirus.dc.gov or just dc.gov, and look under public benefits, and that will explain to everyone what they need to do, whether they've been automatically recertified or whether they're applying for the first time.
You've already done the sort of automatic renewal so people don't have to reapply?
We've already done that. We did that early on. Yes.
Mayor Bowser, normally we would be in the budget season.
Yes.
Of course, we're in a public health emergency. Have you been talking with the DC Council council in terms of when you possibly may present a budget?
In our the emergency that the council passed several weeks ago, we extended the submission timeline for the DC budget. I think the new date is May the 6th. And we'll be ready.
Mayor Bowser, what are you seeing as far as DC employees, particularly essential personnel who still have to go to work, calling out and not showing up? Do you have any data, any numbers? Has that become a problem at all?
We're certainly trying to manage that, Mark. Early on, we put in an extraordinary way more than 50% of our folks on telework. And since that modified operations was announced, somebody remind me of the date. On March the 16th, we've added other people to teleworking. Most notably, we took all of our DMV operations virtual. So now there's no in-person DMV service, and we took all DC operations virtual. And in a number of other agencies, after the first week, we realized that more employees could be teleworking.
How about employment services? Is it becoming a problem there?
We're certainly working to keep everybody at work at employment services. Yes.
The Department of Health often highlights racial disparities with infectious diseases and other health problems. Why not with coronavirus?
As I said, Fennett, we're trying to get out as much accurate data as fast as possible, and our reporting can evolve throughout the process, but this is where we are. Yes.
Just real quick, following up on what Mark was asking about, with Mr. Valentine's passing, you had mentioned last week that there was going to be contact tracing. Has that been done? Is there a sense that there was any threat to anybody else that was essential in the government that worked around him?
I mentioned yesterday that 5 employees are self-quarantining. Yes, sir.
For those of us who usually use the computer to apply for unemployment, because all the computers, all the places we can go are shut down, how do we go about getting the application?
I need you to call employment services, and we will get you a phone number. Yes. Okay, last question.
I'm wondering about DC for the last several years has had a spike in rats, the rat population, which has been attributed to the growth in restaurants and economic activity. Are the pest control people working, and B, what's going to happen with that now that there's no restaurants? Are they all going to head for people's houses? I guess question is, the pest control people working?
The pest control people are essential. Yes, they are working. Thank you, everybody.
We now return to our previously scheduled program, already in progress.
Integrated into the greater Capitol Riverfront neighborhood. We cannot wait to move into this new phase with partners like Chemonics, the support of our elected officials and Mayor Muriel Bowser,